Hello, it's Dorothy McFadden and Lori Rinaldi with another
Hi.
COVID-19 video for you. So today we're talking about a topic that affects post-op patients. So hi, Lori.
Hi.
So I was looking at your lab results and I see that you have quite a few deficiencies. Have you been taking? Yeah.
But I feel fine.
Really?
Yeah.
Do you take your vitamins?
Yeah.
All right, well, why don't you tell me what vitamins you take?
I take, well, the bariatric ones were too expensive. So I got over-the-counter ones. I went to my grocery store and they had a gummy multivitamin that is pretty tasty, and I take one of those a day. And then I heard that you can lose all your hair with surgery. So my hairdresser told me to get biotin. So I'm taking 10,000 of biotin like twice a day. They said only once a day, but I really like my hair, so I'm taking it twice a day just to make sure it doesn't fall out.
Okay, so the gummy vitamin that you got at the supermarket, unfortunately, when you look at that label, it only has maybe 10 nutrients in it.
Oh.
So that kind of explains why your B vitamins were low.
But it said multivitamin on it.
And it has multiple vitamins in it. It just doesn't have all the vitamins that you need.
Oh.
Your body is different now. You absorb less nutrients, less vitamins, less minerals. So one of the things that can happen is you get deficient in your B vitamins. So do you ever notice that your hands might fall asleep when you're driving or something?
Well, only like once a day.
And then what do you do?
I don't know.
So it's important to get all the vitamins that you need because what we do know is with a B vitamin deficiency, you can also have permanent nerve damage. So you can start getting that numbness and eventually it's not going to go away unless you make sure you replete it.
Oh.
So it's important for you to take a vitamin that has all these nutrients in it. So after you have weight loss surgery, your absorption of vitamin A is affected. Do you know what vitamin A is good for?
It's in carrots.
That's beta carotene, and that's a good source of vitamin A because your body will convert the beta carotene to vitamin A. Did you ever hear that carrots are good for your eyes?
Yes.
So vitamin A is very important for night vision, and it's also important for skin integrity. So if you take one of those gummy multivitamins, you don't have enough vitamin A in it.
Uh-oh, then what happens?
Well, then you start getting dry skin, you get dry, what they call conjuncta, the outside around the rimming of your eye. You also have difficulty seeing things at night.
Oh, that's not good.
No, not at all. And it also doesn't contain any riboflavin or thiamine. And thiamine also is very good for your memory and for your nervous system.
Oh, I forgot about thiamine.
That's vitamin B1.
Oh.
Yeah. So some of the other things that you might be missing in those gummy multivitamins is copper and zinc, which are trace minerals that become much more important when you get further out from surgery. So you've had your surgery 7 years ago, and this is right around the time that we would see deficiencies in copper and zinc. So it's important that you get that also.
Oh, but I do take a double dose of Zicam every day because I heard it prevents head colds.
Well, zinc is good for stopping colds and viruses as long as you take it in the very beginning. If you have it for a couple days, it's not going to make any difference. But the problem with taking it all the time is it's going to deplete your copper. If you have too much zinc, it depletes the copper in your body, and then that can cause problems with your nervous system too.
Oh, you can get too much copper? Or too much zinc?
You can get too much zinc.
Oh.
Yeah, definitely. Definitely. So some of the other options that you could look at is there is a vitamin called Bariatric Fusion. And with this, you would take 4 a day. Now, this particular formula contains calcium in it.
Oh.
Do you know what calcium is important for?
No.
It gives you really good bones. So you want to prevent yourself from getting fractures, losing bone density, osteopenia. So this has got calcium in it too. And that gummy vitamin that you're taking doesn't have calcium in it.
Uh-oh.
Okay?
That's good for my teeth too, right?
Oh, yeah, definitely. You can lose some of the enamel on your teeth, and I've actually had some dentists call me concerning their patients because they were losing their teeth because they weren't taking supplements after their surgery. So this particular vitamin you would take 4 a day. And it's a chewable vitamin, and it comes in 5 or 6 different flavors. You can get it online at Amazon. You can go to our Home Star Pharmacy. You can purchase it there, or Bariatric Pal. So this is one option, and you can try and see if you like it.
Mm-hmm.
If you decided to do all over-the-counter vitamins, you would have to do a chewable multivitamin mineral that has at least 22 nutrients in it.
22?
Yeah.
Oh.
You would also have to take B12. 500 micrograms. You would have to take an extra thiamine or vitamin B1, 12 milligrams. You would have to take 1,500 milligrams of calcium. And one of the things about calcium that you need to know is you can't take it all at once. Your body will only absorb a small amount at a time.
So I was just taking all my pills and vitamins in a big handful in the morning. Is that wrong?
And you take thyroid medication too, don't you?
I do.
Yeah, so you're supposed to space everything at least 2 hours apart. So if you're still taking your omeprazole, that's going to affect your absorption of iron and calcium. So you need to separate all that. So in the morning, you can get up early, take your Synthroid, wait a couple hours, and you can do your multivitamin. And then you would have to wait 2 hours before you take your calcium to increase absorption.
Well, geez, that's a lot of things. I'm going to be spending my whole day taking vitamins.
Well, if you don't use a bariatric vitamin, that's true, because you would end up taking about 8 pills. So
that's too many pills.
Yeah.
I ain't got time for that.
Mm-hmm. Nope. And it's really hard to keep track of all that. So another option that you can do are stick packs. These look a little bit like Crystal Light packs. So you could do one of these in the morning and one in the evening.
Are they yummy?
I think they taste good. I like the lemonade myself. And you would also need to take extra calcium, and you would also need to take some iron.
Oh.
Do you know what iron's important for?
No.
It prevents anemia. So iron deficiency anemia, you've got hemoglobin in your blood that carries oxygen, and that helps fuel you and give you energy. And when your hemoglobin's low, you have less oxygenation, so you get really, really tired, and you can even get short of breath.
Oh, that doesn't sound good.
Well, and guess what else it can affect?
What?
Your hair.
But I thought that's what my biotin was for.
If you take iron, you're less likely to have hair loss. Because if you're anemic, you don't grow as much hair.
Uh-oh. I like my hair.
And we all do.
Yeah.
You have beautiful hair.
Yeah.
But the thing is, you can't take all this biotin. That's way too much biotin.
But my thyroid medicine, I take that, and my numbers look good when I get my labs checked, and I thought the biotin was helping with that.
The problem with the biotin is if you take too much, it can really affect the accuracy of your thyroid studies. So you might end up getting too much medication or too little medication. There's been some studies that show that it makes it look like your thyroid's overactive if you take too much biotin. So as a result, your doctor might give you less of your Synthroid, and then actually you're going to be hypothyroid without knowing it, because your blood work's going to show something different. So we don't want you to take more than 600 micrograms of biotin.
Oh, okay. So it's important to adjust my thyroid medicine.
Yes.
Oh.
Yes, it's very important. The other thing that's important too is that they had some cases of individuals who went to the ER with chest pain, and they were tested for heart attack, and their blood work came back normal, but it wasn't. They actually had suffered a heart attack, and it was the biotin that interfered with the accuracy of the blood work.
Well, what the heck? I'd want to know if I actually had a heart attack.
Of course.
That seems important.
Of course. So a couple other quick options we have here. We've got some Bariatric Advantage soft chews.
Do they taste like candy?
They taste like Starburst.
Ooh.
Yeah, so I think you would like these. And they're only 15 calories, and you take 2 of these a day. We also have our soft chew calciums. This
watermelon.
Is watermelon. I love watermelon. The watermelon's really good.
Candy.
And this has in here caramel, and mango. But these come in a variety of flavors. They have assort packs. They have one that's like all fruit flavors. So it's got strawberry and lemon and orange and berry. And then they also have one that's called their sweets, where they have coconut, chocolate, and peanut butter. So you can buy variety bags of these also.
How many of those do you need a day?
3.
3.
And you can't take them together.
Oh. And then how many of the chewy multis?
2.
Oh. So I get like 5 little pieces of candy a day, and that gets all my vitamins in?
And you have to take an iron.
Oh, is there a chewy iron?
Yes, there is.
Ooh, so I can eat 6 pieces of candy a day and get all my vitamins in.
That's right.
Yay. Okay, I'm happy.
All right. So you're going to go home and take your vitamins, right?
All my chewy, tasty ones.
Okay.
Okay.
That's it for today.